This is the passive piriformis test, also known as FAIR test, F-A-I-R. All right, welcome back. In this video, we're going to go through the piriformis test, which is a passive elongation of the piriformis to attempt to provoke symptoms. So these symptoms can either be localized over the deep hip rotator region, the buttock, the posterior hip, or it could reproduce neurological symptoms. So we know the piriformis exits in most individuals with some anatomical variability, but most individuals just inferior to the piriformis. So passive elongation can compress the sensitized sciatic nerve and reproduce lower extremity neurological symptoms. So a quick anatomy review. Remember, this is the passive version of piriformis test. So with any muscle length test or provocation test where we need to passively elongate a muscle, you need to think about proximal and distal attachment and how we passively and maximally elongate a muscle. So I've got my model here. If you think about the proximal and distal attachment of the piriformis, so as we move down the lateral border of the sacrum, this is the inferior lateral angle here. So the piriformis attaches on the anterior aspect of the sacrum near this ILA, and then it projects laterally to the greater trochanter. So with this test, as I mentioned, it's a piriformis test, a passive piriformis test. It's also known as FAIR's test, F-A-I-R, because we're flexing, adducting, and internally rotating the hip to move those two attachment sites as far away as possible and maximally elongate the piriformis muscle. We are testing the right piriformis. We start the patient in side lying. We flex, adduct, and also you can see how my proximal thigh is supporting the distal leg, which as I push into a deduction of the hip also creates an internal rotation moment to maximally elongate the piriformis. We can hold or spring at the barrier to provoke symptoms. Hey, thanks for watching. If you feel this video on the piriformis test was helpful, please consider giving it a like, also subscribing to our OrthoNugs channel. I've included links to two playlists. One is some additional hip special tests, and the other is range of motion of the lower extremity. So some other examination techniques of the hip, knee, foot, and ankle that you may find useful. All right, thanks again for watching.